to kind of guide these kids in the right direction, even more so during this pandemic. 7:33, and right, we talk about pandemic, public health emergency. Always want to have that public health component to the show, and so we bring on from the Department of Public Health and Social Services, where we've already sanitized Dr. K, our virtual Zoom room. We have little duendes that go around and use the Clorox wipes and everything. There's also some virtual coffee and donuts in there, ladies, if you're so inclined. I don't know what kind of diet restrictions. They're vegan. It's vegan coffee. Okay, Janela's got a cup. Okay. And so we have the Chief Public Health Officer, Dr. Susan Kaneshiro of Public Health, and the spokesperson, Janela Carrera. Good morning, ladies.
Good morning.
Morning.
I guess we'll just start with Dr. K. So we had asked you to come on. We saw that spike of 68 positives over the weekend and then even more positives yesterday. So what kind of additional information are you able to shed on that, Dr. K? Or Janela?
Well, the 68 was actually a cumulative of 2 days, right? So on Friday we had 28, and on Saturday we had 40. So it actually wasn't a 68 total in one day, right? So for those positives, they were actually different households, right? So it's a multiple households and not just one big cluster in one place. It's actually a multiple households that contributed to the number of the positives. So at the most, maybe 5 in one household. Others had 2 or 3. So, but it wasn't really a one big cluster
Right.
in terms of positives.
That's almost more alarming when it's not a cluster because it means that we have pockets of infection within different households, like a few of them, right? In my opinion.
So these were actually contacts that were tested. So they're actually identifying people in the household to get tested. So that's actually pretty good because then you're really having these household tested to make sure they're negative or positive. So it's actually working, the contact tracing.
Right. Yeah. And so, what are these positives saying after you guys do the contact tracing and they test positive for the virus? What's the reaction that you're hearing?
Well, so maybe these households don't have enough space for the household members. For example, maybe 4 or 5 people living in one house, one bathroom. So it's very difficult to isolate themselves. So that's why sometimes we ask the positives to go to the isolation facility, just so that the household members are not exposed.
Are we
So
seeing?
that's
Are we seeing people not wanting to go to the ISOFAC, and is that why we're seeing a lot of household spread, Dr. K?
it may contribute, because maybe they don't want to leave their family members. So maybe it's actually better if they're um, isolated at the isolation facility for
Right.
the
Yeah.
most part. Yeah.
So, do you know how many people we have at the ISOFAC?
Currently we have we have let me see. We have 31. We have 31 at the isolation facility
And are these
as of yesterday.
right? Are these all
They're a combination of travelers as well as community members. So if they feel that their home is not conducive, they're actually they ask to go to the isolation facility. So these are travelers and residents.
We've been in this lockdown, I think, going on a month and a half, I believe. What is the data showing? Are we? Is it working or is it not working or it's kind of working?
Well, actually, the numbers of positive are actually decreasing. We don't see as much as we were seeing last month. So it's a good sign that it's actually decreasing somewhat. It's not as much as before.
Right. Yeah. We went from, I think when we hit our peak, it was like over 100 cases, 80 positives, 80 to 90, and then it started to decrease a little bit. We plateaued, I think, So we are seeing a gradual decrease in positive cases.
And how much is of that is because we're not testing as many people?
I think we're still, Dr. K, correct me if I'm wrong, we're still continuing to do testing on a daily basis. We haven't done that one massive testing like we did back in August when we did over 1,400 and we have one coming up. We have one coming up at DOC. We have community outreach for high risk population. So every single day we're doing testing at our northern site. So it's continuing to be done. It's just we haven't had that one massive testing that we did back in August.
So, Dr. K, that being said, maybe you could just clue us into the testing posture at public health. Who's getting tested? What kind of outreaches are you doing? And tell us a little bit more about the high risk testing. So, just I guess round robin on where we're at with testing and public health.
Okay, so at the Northern Region Community Health Center, we test over 120 people Monday to Saturday, and most of those are actually contacts of positive. So that's where we get most of our positive is actually at the community health center because we refer the contacts to get tested there. We also do targeted testing. For example, last week we did actually the GPD actually. So they asked if the first responders can get tested. So there was no positive when we did that. It's just that they wanted to make sure that everybody was negative. Right, so that's what we found. So we tested GPD last week. We also tested at DOC because we were wanting to test all of the staff and inmates to make sure nobody was positive. So there was no positive there either. But so we have one more day at DOC this Thursday to finish the remaining inmates and detainees. So then we also have that UMATIC outreach on Saturday.
Right.
So we're also intending to do actually more village outreaches in the future.
Right. Dr. K, when you talk about the contact tracing and it working and the positives we've seen, is it a safe assessment to say that when we look at these close contacts that you guys are testing and yielding the positive results from today, are those like are these people the tail end of the contact trace investigations for this second surge here?
I can't say. I can't say because we're still not going down yet. And so we're trying to get as many of these contact households to get tested so they stay home, quarantine, right? And so we're trying to get as many of these contacts to get tested. Because a lot of them are asymptomatic, so they don't know, so they just go out. So we're trying to make sure that they get tested as soon as they're identified, so they stay home and not spread it to the community.
Based on the data from this past few weeks of lockdown, are we ready to reopen more businesses?
Actually, the governor's looking at that. So as if the numbers indicate that we're actually going down, she may open up more businesses, less restrictions. So she's just waiting for the numbers to go down, and then she'll probably decide to open up more of the establishments and businesses.
And I think, Dr. K makes a good point there is that, when Governor Guerrero makes decisions, she bases it on evidence. She consults with her team of experts, with the Physicians Advisory Group, with her Economic Recovery team, with the folks here at Public Health, and of course, what the numbers that come out. She just lifted some restrictions last week, and so it really depends. It was just a few days ago, so it really depends on the numbers that come forth in the next few days. So it's really remains to be seen what happens this week and what the numbers show us in the data. So
Right. Dr. K, when we had Dr. Hoa Wen, who's the spokesperson for the Physicians Advisory Group, on ahead of the easing restrictions on Friday, he had told us that the people of Guam should take comfort in a guarantee that the openings and the activities surrounded around these newly opened businesses and the customers, it would all be closely monitored to make sure that the virus isn't spreading because of these openings. That being said, how are you guys involved in that monitoring process?
Well, actually, the Division of Environmental Health does do inspections every single day to make sure that these businesses are in compliance. And so they're making sure nobody's mass gathering. And so they're going out there every day to make sure that the businesses are in compliance with the executive order.
Yeah, I really do want to give kudos to them because their team is out there really, anytime that they receive a report, they are on top of things really rapidly, quick. And their inspection report is pretty thorough. And the community too, they whenever they receive a report or any type of suspicion, they're almost like they're the community police. They report it themselves as well.
Right. I wanted to follow up on the new test out program over at the quarantine facility that I think that went into effect on Saturday. Day 6, you get to take a test, and then day 7, if it's negative, you get to be released to home quarantine. Have you guys already tested people that met that 6-day requirement? And if so, how many people have tested negative and have been released to home
So
quarantine?
we have, go ahead, Doctor.
Go ahead. Okay, so we started testing Friday. So on Friday, we tested 82. Saturday, we tested 127. Sunday, we tested 20. And yesterday, we tested 40. So for these are people that are tested on their 6th day. If they're negative, they're transferred to home quarantine, right? So all the testing we did, we found 5 positives. So those travelers were sent to the isolation facility.
And everybody
So
else
that's
was
what we-
released to home quarantine.
Correct. So
Okay.
everybody was transferred to home quarantine that were negative.
How many people, do you have the breakdown on how many people are in quarantine facilities now?
Quarantine facility has 397 travelers. So every day we test out more people. Once they hit their 6th day, we test more. And so today we have 74 that's going to be tested. So every day we test people out.
And then those are included in the daily results?
Correct.
Okay.
So for example, they're tested in the afternoon. So it's the next day you'll get the count. You get the results in the next day.
Dr. K, how many, because I saw in the numbers that you guys provided with us from over the weekend, I think there were 12 new positives. Those, and then combined with yesterday's results, how many new positives unconnected to existing contact trace investigations have we seen other than the 12 and then whatever you had yesterday? And where are these cases coming from?
Well, if they're not contacts, they're probably community contacts that maybe they were symptomatic and want to be tested at the various clinics, not just public health. And so so those are counted in our count. So if they're tested at other sites, we also report those if they're a test positive or negative. So we do count them in our count.
And for the people that are released onto home quarantine, they are all required, right, to download this Sarah alert?
So the Sarah Alert is actually, so it's not an app, and we actually haven't launched it yet. It'll be launching this week. But once we do launch it, we will be asking that they be enrolled into Sarah Alert. It's a symptom monitoring system, basically. And the way it works is anytime that they have some sort of symptom that they're feeling, they get a message, basically. It's either through web text message or phone call, and it'll ask them if they feel any sort of symptom related to COVID-19, and they just report it, whatever symptoms that they're feeling, or if they're not feeling any symptoms, then they just note that they don't feel any symptoms.
So then,
But that's the goal. The goal is to get all travelers or residents enrolled into Sarah Alert.
so how then are these individuals that have been released to home quarantine that tested negative on day 6? How are they being monitored?
So we have yeah, go ahead. Go ahead.
I was just going to, public health is one that's doing the daily monitoring. We have a public health that constantly, checks on them, contacts them daily to ensure that, they're adhering to the monitoring protocols established by public health.
I know that Dr. Wynn, he was mentioning that it was going to be a mandatory type of deal where if you are released into home quarantine that you would have to have this Sarah Alert. So that's no longer going to be the case going forward.
Once we launch, that is going to be the goal, that they are going to be enrolled into the Sarah Alert system.
Okay.
If we could, Dr. K, maybe closing a statement to the public. Something I saw in the with the announcement. I mean, God, 3 COVID-related fatalities last night. There was one where the 44-year-old woman.
Right.
And what we're seeing, what we're hearing from Lillian and a lot of the frontliners is that people are showing up at the hospital when they're already at death's door and the virus has run through them and they're waiting really long to go get the help that they need. Dr. K, can you speak any about anything on that?
Well, maybe, because once they go into the hospital, they don't see their families anymore. So maybe one of the reasons they don't want to be alone, maybe. And so I'm not really sure why they're waiting so long. So maybe it's because they don't want to be alone. Because once they're in there, they're not allowed to see family.
Right.
That's
So-
one of the reasons.
So what would your message be to people out there who are suffering from symptoms of COVID, maybe haven't been tested, maybe you're right, struggling with that fear of isolation?
Well, I encourage them if they are symptomatic, get yourself tested, because we do offer free testing at the community health center. And because the sooner you get treatment, the more likely that you will recover, right? And so we do encourage them, to seek treatment as soon as possible, especially if you're having difficulties breathing, you have fever, and so we do encourage that.
All right. Thanks, Dr. K. Janelle, any final message?
Yeah, I wanted to add, earlier Dr. K had mentioned that there may be some homes where there's multiple contacts, and quarantining, sometimes it's difficult to get, especially when you're together. One of the things that public health that we're trying to bring awareness to is, when you start to feel symptoms at home, one of the things we really encourage is, as soon as you feel the symptoms, sometimes it's a little difficult to separate yourself from your family when you start to feel symptoms. But you should, as soon as you feel it, try to isolate yourself from others in your home. It's a little difficult because we're the type of culture, the type of community where we're very close to our family. I myself, I'm guilty of that as well. In the beginning of this pandemic, I made it a point where once I came home from work, I distanced myself from my children. I didn't allow them to touch me. I didn't touch them. We made absolute no contact whatsoever. I have an immunocompromised son at home. We didn't speak to each other except through text messaging. When he came out of the room, I wasn't allowed out of my room, and vice versa. And then when the numbers started to go down and we would only see 0 to 1 positive cases, we started to, make more contact at home. But then when they started to go back up, I sort of kind of threw the initial rules that I established out the door, and I'm still making contact with him, and I'm guilty of it myself. So I have to remind myself and even the community that you know, we shouldn't be careless about these types of realities that are facing our community. And, you know, I probably should start implementing those rules again in my household, because I could bring it home one day and get my children sick without knowing it, because I may be asymptomatic. So, you know, the minute you start to feel sick, or you may be a possible contact to somebody, you should really just start to isolate yourself at home, because you could bring it to your family as well. So I want to put that out there. I remind the community about, you know, these possible scenarios to prevent any further spread within your own family, your own household, and into the community.
Yeah, to add to that, you know, my parents are in their 80s. And so I tell them not to leave the house unless they have to, but for the most part, they stay home. They're very limited in number of people that come to the house. And I try to avoid going there as much as possible, you know, maybe limit the contacts with my parents, you know, stay 6 feet distant with my parents, right? But I'm scared to death for them, because they're in their 80s. And, you know, and so I know if they become COVID positive, you know, the chances are they're a very high risk group. Right. And I'm really scared for them. And so I try to avoid, I don't go to parties anymore. You know, I just go home and work. That's pretty much my life, right? Yeah. But I'd rather be safe than sorry for my, you know, because of my parents.
Yeah.
So, right. So I don't go to parties anymore, I'm telling you.
There's no parties, Dr. K.
Right, hey.
I mean, unless you know about one, let me know, and I got a 311 number I can call.
Yeah, so I don't.
Yeah.
And so I do that for my parents. I am scared to death for them.
I guess the ultimate message is, even within your own household, you know, try to limit contact as much as possible. I know that's impossible, but, you know, if you can, by all means, try to limit that, especially if you're the one that's leaving your house to go to work, or for whatever reason it is. Limit contact as much as possible.
Thank you, ladies.
Thank you.
Appreciate that personal touch there at the end. That's really insightful. Appreciate it, Dr. K. Janela. Thank you.
Thanks.
Thank you so much.
Okay, we'll see you guys. Wash your hands. Stay home.
Bye.
Give it a couple minutes as they sanitize the KUAM News Zoom room. We're good. They're sanitized. Okay, we're good. Let's go back in where we. First of all, let me just tell you.